Endometriosis. Sites of endometriosis. Common sites. Rare and remote sites. Ovaries. Pelvic peritoneum. Pouch of Douglas. Uterosacral ligaments. Rectovaginal septum. Sigmoid colon. Appendix. Pelvic lymph nodes. Fallopian tubes. Umbilicus. Abdominal scar. Episiotomy scar. Lungs. Pleura. Ureter. Kidney. Arms. Legs. Nasal mucosa. Risk factors for endometriosis. X low parity. X delayed childbearing. X family history of endometriosis. X genital outflow tract obstruction. X environmental toxins dioxins. X peritoneal fluid abnormalities Table 22.2. Endometriosis and adenomyosis. 22. Endometriosis. Prevalence. Sites. Pathogenesis. Pathology. Diagnosis. Differential diagnosis. Complications of endometriosis. Treatment of endometriosis. Surgical management of endometriosis. Endometriosis at special sites. Adenomyosis. Causes. Pathogenesis. Pathology. Clinical features. Treatment. Chapter outline. Chapter. Definition. Presence of functioning endometrium glands and stroma in sites other than uterine mucosa is called endometriosis. It is not a neoplastic condition, although malignant transformation is possible. These ectopic endometrial tissues may be found in the myometrium when it is called endometriosis interna or adenomyosis. Most commonly, however, these tissues are found at sites other than uterus and are called endometriosis externa or generally referred to as endometriosis. Endometriosis is a disease of contrast. Although it is a benign, but it is locally invasive and disseminates widely. Cyclic hormones stimulate growth but continuous hormones suppress it. Women with extensive disease may remain asymptomatic, whereas a patient with minimal disease may have incapacitating chronic pelvic pain and other symptoms. Endometriosis is an aggressive, progressive and invasive disease. Prevalence. During the last couple of decades, the prevalence of endometriosis has been increasing both in terms of real and apparent. The real one is due to delayed marriage, postponement of first conception and adoption of small family norm. The apparent one is due to increased use of diagnostic laparoscopy as well as heightened awareness of this disease complex amongst the gynecologists. The prevalence is about 10–15%. However, prevalence is high amongst the infertile women 30–45% as based on diagnostic laparoscopy and laparotomy. Sites D Table 22S1C. Abdominal. Extra-abdominal. Remote. Abdominal. It can occur at any site but is usually confined to the abdominal structures below the level of umbilicus. Table 22S2 Peritoneal fluid. Cytokines and growth factors. Concentration. Increased. Concentration. Decreased. Concentration. Unchanged. Complement. Glycodelin interleukin IL-13 EGF. Interleukins. IL-1, IL-6, IL-8 TGF-B, VEGF basic FGF. PDGF, RANTS, TGF-B, VEGF FGF. Interleukins. IL-2, IL-4, IL-12. TGF-B. Transforming growth factor B, VEGF, vascular endothelial growth factor, FGF. Fibroblast growth factor, PDGF, patellic-derived growth factor. Extra-abdominal. The common sites are abdominal scar of hysterotomy, cesarean section, tubectomy and myomectomy, umbilicus, episiotomy scar, vagina and cervix.